Welcome to the Coding and Documentation for Alzheimer's Disease short education video. Please watch this entire video, which is not all-inclusive and does not serve as consulting or legal advice. This short program is intended to provide increased awareness about this devastating disease and to help you improve your coding skills. Alzheimer's disease is an irreversible, progressive brain disorder that slowly destroys memory and thinking skills, and eventually the ability to carry out the simplest tasks. Estimates vary, but experts suggest that more than 5.5 million Americans, most of them age 65 or older, may have dementia caused by Alzheimer's. Alzheimer's is the most common cause of dementia among older adults. Alzheimer's disease is currently ranked as the sixth leading cause of death in the United States, but recent estimates indicate that the disorder may rank third, just behind heart disease and cancer, as a cause of death for older people. Dementia is the loss of cognitive functioning, thinking, remembering, and reasoning, and behavioral abilities to such an extent that it interferes with a person's daily life and activities. Dementia ranges in a severity from the mildest range, when it is just beginning to affect a person's functioning, to the most severe stage, when the person must depend completely on others for basic activities of daily living. Scientists continue to unravel the complex brain changes involved in Alzheimer's disease. It seems likely that changes in the brain may begin before memory and other cognitive problems appear. During this preclinical stage of Alzheimer's disease, people seem to be symptom-free, but toxic changes are taking place in the brain. Abnormal deposits of proteins form amyloid plaques and tau tangles throughout the brain. Once healthy neurons stop functioning, lose connections with other neurons, and die. Many other complex brain changes are thought to play a role in Alzheimer's too. Scientists continue to unravel the complex brain changes involved in the onset and progression of Alzheimer's disease. It seems likely that the changes in the brain may begin a decade or more before memory and other cognitive problems appear. Many other complex brain changes are thought to play a role in Alzheimer's too. The damage initially appears to take place in the hippocampus and the entorhinal cortex, parts of the brain essential in forming memories. As more neurons die, additional parts of the brain are affected and begin to shrink. By the final stage of Alzheimer's, damage is widespread and brain tissue has shrunk significantly. Documentation is important when reporting this condition on a claim form. From a clinical standpoint, documentation may reflect the stages of this disease, from mild, moderate, to severe. However, coding reports this condition differently, as early onset, late onset, and unspecified. Mild Alzheimer's disease. As Alzheimer's disease progresses, people experience greater memory loss and other cognitive difficulties. Problems can include wandering and getting lost, trouble handling money and paying bills, repeating questions, taking longer to complete normal daily tasks, and personality and behavior changes. People are often diagnosed in this stage. Moderate Alzheimer's disease. In this stage, damage occurs in areas of the brain that control language, reasoning, sensory processing, and conscious thought. Memory loss and confusion grow worse, and people begin to have problems recognizing family and friends. They may be unable to learn new things, carry out multi-step tasks such as getting dressed, or cope with new situations. In addition, people at this stage may have hallucinations, delusions, and paranoia, and may behave impulsively. Severe Alzheimer's disease. Ultimately, plaques and tangles spread throughout the brain, and brain tissue shrinks significantly. People with severe Alzheimer's cannot communicate and are completely dependent on others for their care. Near the end, the person may be in bed most of the time as the body shuts down. Accurate ICD-10-CM coding for Alzheimer's disease requires coding not only the disease itself, but also any associated manifestations of the disease. Codes for the Alzheimer's disease are found in category G30. The fourth character of the code indicates the onset of the disease, as listed here on this slide. Category G30 has a note to use additional codes to identify delirium, if applicable, and dementia. Alzheimer's disease is the most common cause of dementia. The provider does not have to give a diagnosis of both Alzheimer's disease and dementia to code both conditions. Coding for dementia requires a fifth character to identify the presence of behavioral disturbances. Examples of behavioral disturbance include psychotic symptoms, agitation, apathy, or combativeness. Searching for Alzheimer's disease in the alphabetic index, you will see that G30.9 is listed first, with F02.80 or F02.81 in brackets. Brackets tell you that the code is for a manifestation that may not be used for the principal diagnosis. Sequencing instructions can be found in the tabular list as well. For category F02, there is a note to code first the underlying physiological conditions causing the dementia. You will also see a note accompanying code F02.81 to use an additional code, if applicable, to identify wandering in dementia in conditions classified elsewhere, such as code Z91.83 to report wandering in dementia in conditions classified elsewhere. Because these codes represent information that is extremely important to the caregivers responsible for the safety of patients with Alzheimer's disease, it is essential that the coder capture the appropriate additional codes according to the documentation provided. We hope you enjoyed this short educational video. We offer short online coding courses as well as comprehensive programs with the option to certify. Please check out our website by going to aihc-assn.org today.